We've covered a lot of ground in this series. What makes a peptide legal or not? Who carries the risk? The myths around the bulk drug list. If you've been paying attention, you might be feeling a little nervous right now, or maybe a lot more informed than you were before. Either way, this final video is about what you actually do with all of this, because the goal here isn't to scare you out of the peptide space. The science is genuinely fascinating, and many of these compounds show real promise. The goal is to help you engage with this space from an informed position, and that starts with asking the right questions. Question 1. Is this peptide FDA approved or unapproved? This is the foundational question. Approved peptides like semaglutide and tesamorelin can be legally prescribed off-label. Unapproved ones like BPC 157 and TB 500 operate in a completely different legal environment. If you don't know which category yours falls into, find out. Question 2. What is the source and quality? Pharmaceutical-grade compounds from a licensed compounding pharmacy carry far less risk, both legal and health-wise, than research-grade materials purchased online. Research-grade means it's been tested for lab use, not human consumption. That's not a small distinction. Question 3. Does your prescribing physician actually understand the legal environment? This might be an uncomfortable question to ask, but it matters. Some practitioners in the functional medicine world are prescribing unapproved peptides without fully understanding their own legal exposure. A doctor who doesn't understand the risk landscape can't adequately protect you or themselves. Question 4. What does the human data actually say? Many popular peptides have robust animal studies. The jump from mouse data to human outcomes isn't automatic. Ask for what exists. And if the honest answer is, we don't know yet, you deserve to know that. Question 5. What are the realistic best and worst case outcomes for you, specifically? Not for the average user in a forum thread. For you, with your health history, your goals, and your risk tolerance. Are you prepared to accept the outlier scenarios? Here's a helpful mental model. Think about driving. Nobody panics about going 5 miles over the speed limit on a highway. It's technically illegal, but it's tolerated, normalized, low consequence. But that same calculus completely falls apart if you're doing 75 in a school zone after drinking. Peptides work the same way. There's a meaningful difference between a cautious physician prescribing a well-studied peptide with some human safety data to an informed adult patient, versus prescribing a novel, uncharacterized compound stack with no human data to someone who doesn't understand the risks. The former is a judgment call in a gray zone. The latter is a school zone. The degree of risk, legal and ethical, scales with the quality of the formulation, the route of administration, how much human safety data exists, and how novel the compound is. One final point that's easy to underestimate. Enforcement norms in this space can and do shift, and they can shift quickly. What's tolerated practice today can become the target of a DOJ sweep tomorrow, especially as the volume of peptide use escalates, or if serious adverse events start accumulating publicly. The peptide space has grown dramatically in the last few years. That growth makes a regulatory response more likely, not less. If you're a physician prescribing in this space, staying current on regulatory developments isn't optional. It's part of your risk management. The peptide landscape is genuinely exciting from a science and longevity standpoint, and responsible biohacking has always been about engaging with the frontier intelligently, not recklessly. That means understanding the legal environment, sourcing carefully, finding practitioners who know what they're doing, and making decisions from an informed position. You don't have to stop being curious. You just have to be as rigorous about the legal and regulatory side as you are about the biology. That's responsible biohacking. Engaging with the frontier intelligently.